Hello everyone. Today we will talk about the types of drugs. Now in this section I am going to take neurologically active drugs first. So what are neurologically active drugs? These are simply the medicines or the drugs which we take to get relief from the tension. The drugs which we are using as the sleeping pills or to relax ourselves, to remove the stupor, those drugs are called neurologically active drugs. Now, these neurologically active drugs affect the message transfer mechanism from nerves to the receptors. Now, these types of drugs are of two types, tranquilizers and analgesics. Tranquilizers. They are also known as antidepressant drugs. Now, these antidepressant drugs, for example, iproniazid, phenelzine, they are used to reduce depression. Chlorodiazepoxide and meprobamate are relatively mild tranquilizers suitable for relieving tension. Equanil is used in controlling depression and hypertension. Barbiturates such as seconal, luminal, veronal are hypnotics, means they are sleep inducing, whereas Valium and serotonin are non-hypnotic drugs. Reserpine, a tranquilizer obtained from Indian plant Rauwolfia serpentina, is a very common and very potent tranquilizer. Now, how do they act? What is their work action? Tranquilizers, they do not work on a common mechanism. Rather, it varies from one drug to the other. For example, noradrenaline is one of the neurotransmitters which act as a messenger and it helps in mood changes. Now, in case it becomes deficient due to some reasons, then the person suffers from depression. This is caused by retardation in the signal sending capacity of the messenger. In such a situation, antidepressant drugs are given. These drugs inhibit the enzymes which catalyze noradrenaline. As a result, it will slowly metabolize and can activate the receptor again. Now, after this, I am going to discuss now analgesics. So, analgesics, they are simply defined as the chemical substances which reduces pain. So these are used for relieving pains in the body and they act on our central nervous system. Analgesics are actually neurologically active pain-killing drugs. They can reduce pain or they can abolish pain, but sometimes they are also harmful. So analgesics are of two types. Number one, narcotics, and number two, non-narcotics. So let's talk about non-narcotics. Non-narcotics, as the name suggests, these are not the opium derivatives and these are not habit making. That's why it's written non-addictive. So non-narcotics are non-addictive analgesics. The common examples are aspirin and paracetamol. Now they can also reduce our fever. So they can work as analgesics as well as antipyretics. Let's talk about aspirin. So what is the IUPAC name of aspirin? That is acetyl salicylic acid. Paracetamol and aspirin, both are non-addictive analgesics. Aspirin, it inhibits the synthesis of chemicals known as prostaglandins which stimulate inflammation in the tissue and cause pain. Because of its anti-blood clotting action, aspirin is also used in the prevention of heart attacks. Now coming to narcotic analgesics. Narcotic analgesics. Narcotics, as the name suggests, means habit making. So drugs which produce sleep and unconsciousness are called narcotics. Now, most of the narcotics are opium derivatives and are extracted from poppy leaves, so they are called opiates. Opium contain morphine and its derivatives codeine and heroin. Now they are highly effective analgesics. They are given to the patients after the surgery. So they are given to remove the pain in case of post-operative surgeries, in cardiac arrest, means in cardiac pains, and also in cancers. Morphine can also be acetylate